Hi everyone, welcome to our webinar, New Year, Healthier You and Your Building, where we'll be discussing health and well-being in the built environment. My name is Kelly Worden and I'm part of the marketing team here at Measurable. A few logistics to go over before we get started. All attendees are in listen-only mode. This means that upon entrance, you are automatically muted. We do want to keep this a casual discussion, so feel free to submit your questions at any time throughout this webinar. You can submit questions through the Q&A window in your control bar. This webinar is being recorded and it will be distributed to all registrants at the end. So, thank you for joining us. Just a quick agenda for the day. We're going to meet Kelly Worden, who is joining us from the U.S. Green Building Council. Then we'll go straight to a discussion around health and well-being. Like I said, casual discussion. Feel free to participate. So why are we here today to talk about health and wellness? Well, we spend about 90% of our time indoors, according to the U.S. Environmental Protection Agency. The rest of the time, when we're not inside, we're likely right in the proximity of buildings. Our built environment has a huge impact on our health and how we operate on a day-to-day basis. Understanding exactly how these buildings impact us is important not only to key stakeholders like investors and tenants, but just to all of us as human beings. So we're happy to have an expert on these matters speaking with us today. Kelly Worden serves as Director of Health Research at the U.S. Green Building Council. She oversees the Green Health Partnership between the University of Virginia School of Medicine and USGBC, which aims to apply green building principles of market transformation for health promotion. Kelly's background is in public health at a global scale. So Kelly, thanks for joining us today. We appreciate your time.
Great, thanks so much for having me. I'm excited to be able to have this discussion about health and well-being in the built environment. So to get us started on the same page about why I, as a public health person, am interested in the built environment, and just kind of ground us in what we mean when we say health and well-being. Oftentimes, people think immediately of the healthcare sector, but in fact, only 20% of health outcomes depend on healthcare, which is pretty incredible when you think about how much we spend on healthcare, particularly in the US. So if you go to the next slide, you'll be able to see that from both a public and private sector standpoint, the US is spending a lot more than other countries. In particular, on this graph, pay attention to what the US private sector spends. In 2016, we spent a little over 8.5% of our GDP on healthcare within just the private sector in the US, and that's compared to a little over 2.5% of GDP spent by the private sector in other countries. So thinking just from a business perspective, as we operate in more global markets, US companies are at a disadvantage due to the increased costs that we have to bear on healthcare. And it's inefficient because, as we saw on the last slide, only 20% of health outcomes are determined by healthcare access and experiences. And as you may know, even though the US is spending more on healthcare than other countries, it's not necessarily getting us better outcomes. In fact, the US ranks 26th out of 35 OECD countries for life expectancy. The average life expectancy in the US is 79 years compared to 84 years in Japan, which is the leading, and then 82 years in Canada, just north of us. So if healthcare isn't determining our health outcomes, what is? If you go to the next slide, we see that part of it is genetic code, which you would probably expect, but in fact, zip code is a more significant determinant of life expectancy than genetic code. And that's because the built social and economic environments that we live in, work in, play in, go to school in, play a major role in determining health behaviors and outcomes. And that's really what led our team, the Green Health Partnership team between USGBC and UVA, to look at what we could do within the built environment to encourage the creation of more health-promoting places. So if you'll go to the next slide, you'll see our vision as the Green Health Partnership. So just a quick background on who we are. It's an R&D initiative between the University of Virginia School of Medicine and the U.S. Green Building Council. It's led by Dr. Matt Trowbridge over at UVA. And since about 2013, we've had the benefit of receiving funding from the Robert Wood Johnson Foundation, which is the largest public health foundation in the U.S., to really look at what we could learn from the green building movement in terms of creating a new culture of practice within real estate. So in many ways, the green building movement was able to create a culture in which sustainability and environmental issues were valued within real estate. And we want to do something similar from a health perspective. So going to the next slide, specifically what we've been working on is creating new health promotion tools for use within existing green building or green investment platforms. So as Kelia mentioned, my formal role is I'm positioned at the U.S. Green Building Council, but this partnership that we have with UVA and the funding that we have from RWJF has allowed me to work very closely with the GRES team in Amsterdam as well. So we've had two levels of focus within our work. One is at the individual building scale to create new health promotion tools for use within green building frameworks such as LEED. And then the other is at the portfolio scale, thinking about how to create health promotion tools for use within real estate investment. So going to the next slide, at both of these levels, we're really aiming to define a new approach to green building practice that follows more of a health promotion process. And this process is one that's inspired by health impact assessment, which is an existing framework that really aims to position health as a decision-making lens within non-health sectors. And we've been inspired by this framework, but sort of distilled it down to a few simple steps, which is engaging new stakeholders, engaging the community that's impacted by the project, bringing in folks with more of a health background or maybe an HR background, and using this engagement to build an understanding of the unique needs of that population from a health perspective, and then prioritizing action according to those needs, and finally evaluating impact to make sure that the actions are having the impact that you intended. So going to the next slide.
I actually do want to sit on this for,
oh, sure.
If you don't mind. I want to sit on this slide for a minute because it seems like this is a very straightforward four-step process. So I'm curious to know how your organization got to this process. Like, how did you come to these 4 steps? And if you could give us an example of using this in real life, that would be great.
Yeah, that's a great question. So we, back in 2015, collaborated with Enterprise Community Partners, which has a green building system for use within affordable housing, as well as the Health Impact Project, which is an organization dedicated to supporting the use of health impact assessment. And we came together to work at creating some sort of health promotion process that would work and be viable within the context of the average building project. And one of the things that motivated us to focus on process was that looking at green building, as well as the new, more health-specific building certifications like WELL and FitWell, we realized that there's a number of existing specific strategies to target really specific health needs or desired outcomes, but there wasn't a framework that allowed practitioners to bring all of these different tools together in a really cohesive and efficient manner. And so health impact assessment has been very effective at guiding decision-making in a variety of scales, policy level, well, actually a lot at the policy level, but also down at individual project level as well. And so we kind of took that and ran with it and came to these 4 steps. Specifically, what we've seen within a building project, for instance, is that this first step, and actually this is true at the GRES, at the portfolio scale as well, the first step of engaging community and public health expertise. So we started off thinking about this as like very specifically a public health practitioner coming into the team. We've sort of evolved to think of this more loosely as just new voices and new areas of thought coming in and providing guidance on a project. And we've seen that alone is incredibly valuable. So real specifically, one of the teams that we worked with to deploy this process at the campus scale is a big corporation that had an existing pretty robust health benefits team that hadn't really been involved in the decision making around how the corporate campus was designed and operating, and bringing them into the conversation at the campus planning scale allowed them to have input on the types of programming that they ultimately wanted to deploy, which allowed the building team to think more creatively about how they would design those spaces, and kind of brings together the conversation between more traditional environmental considerations and these more emerging health considerations at the beginning of the project, which allows for more of an efficient and seamless combination of those two different areas.
Kelly, this is Heather. Sorry. I'm just curious on this. Does the appetite for this sort of process, does it vary by country and any information you can provide there?
Yeah, that is a good question. So for our building scale work, we've really been focused on the US. When it comes to GRES, that's a very global platform. And so we've seen pretty wide participation within the version of this that we've applied within GRES, which is the health and wellbeing module. Unsurprisingly, for anybody that's familiar with sort of the global landscape, some of the traditional leaders like those in Australia and Europe were really quick to take this on. And actually health impact assessment itself was originally created in Europe and has also been very widely used within Australia within built environment context as well. But interestingly, when you dive into the numbers, while there are more funds participating from Europe and Australia, those participating from North America are actually much larger. So we've much larger from a square footage perspective. So from that perspective, we've seen a lot of uptake within the US as well. But I think in general, what we've heard from practitioners, particularly back down at the project scale, is that this type of process is pretty refreshing for them. It kind of flips the typical conversation that a team might have when it comes to applying LEED or any other sort of building scale framework. And instead of saying that this is this is the answer, no matter what your problem is, it allows practitioners to be a bit more creative in how they apply that specific tool and drives a more interesting conversation with the owner about what their goals are and how to best use the tool of LEED or whatever other system you're working on to meet those goals. So this is just showing really specifically what this process looks like within LEED. We deployed this as a pilot credit back in 2016. The process is also available for use within the Enterprise Green Communities criteria for use within affordable housing. And it's actually also our friends over at Green Star, or at GBC Australia, actually implemented this within the Green Star rating system as well. So it's been available as a pilot credit for use within both LEED v4 and LEED 2009. And moving forward, we're actually working to integrate aspects of this into LEED v4.1, so that it'll be part of the integrative design credit within the core rating system, which we're very excited about. And then, moving on to the GRES side. So with GRES in 2015, we were able to work with GRES to develop the health and wellbeing module. So for those that might not be as familiar with GRES, well, actually, I'm sure many of you are, but it's a portfolio level assessment that runs on an annual cycle. And we were able to create this module as a add-on voluntary module for real estate companies to respond to. What we were really excited about, if you'll go to the next slide, you can see the participation numbers. In 2016, the first year of the module, we had 174 real estate companies and funds choose to participate, and the number increased from there. And when we look at the number of funds that have participated at any point within the 3 years of the module, we actually had 399 funds participate at least 1 year within the module, which we're really, really excited about and see as an indicator of the growing interest in health and well-being at the company and investor scale as well. And so similar to our work with USGBC to kind of take aspects of that pilot credit and influence LEED v4.1, we're now working with the GRES team to take aspects of the health and well-being module and integrate it into the core GRES real estate assessment that'll be released in about a month and open for participation on April 1st.
Fantastic. So on this health and well-being module, I know it's only been in use for a few years, but I'm curious to know what you've learned from the responders. It seems like, there's growing interest. There are more companies and funds participating across geographies. So what are the major takeaways that you've gotten in the first 3 years of receiving responses?
Yeah, so one of our main takeaways was the level of interest. The other thing that's been really fun to watch is the kind of quick improvement of those companies that have participated all 3 years. What we've heard from GRES participants in general is that participating in GRES, even the core real estate assessment, helps companies kind of better organize things that they're already doing. So it's not necessarily that they're going to do something totally new just because there's one GRES indicator on it, but having GRES ask you about something causes this reflective conversation within a company that allows companies to understand, oh, we are doing this great thing. We're just only doing it in part of our portfolio. And now we can take this as an opportunity to implement a policy and make it more of a systemic action throughout our portfolio. And so we've seen companies improve quite significantly over the 3 years. So within the module, the way that process looks is that it's asking about leadership for health, a policy for health, and then also running through the needs assessment, the action, and the monitoring. We've seen that a lot of companies have implemented policies for health. A lot of companies are taking action for health, but maybe not surprisingly, not as many are monitoring health in a robust way. And so that's still one area of improvement. The other unique thing about the module is that it actually has 2 different components. One is more internally facing, asking companies about their efforts to promote their own employee health. And then the other is externally facing, asking real estate companies about their actions to promote the health of their tenants, the users of their buildings, and also the communities around those buildings. And what we've seen there that's been interesting is that companies are not likely at all to do well externally if they're not also doing well internally. So we've seen that as a bit of a maybe performance improvement pathway, that it's helpful to first focus on your own internal efforts and then kind of exhibit that focus externally in terms of how a company is managing and developing their real estate assets.
So on that last point that you made, if I'm understanding correctly, you're saying that most of the respondents, they have internal policies or internal actions to make sure that their own employees are benefiting in some way from their health and well-being efforts before going external to, say, maybe creating some sort of project that would benefit tenants or occupants, et cetera. Is that generally what you've seen?
Yes. Yep. Yeah. Which isn't that surprising. And actually, when we first created the module, we thought really intentionally about creating something that wouldn't be daunting to the market, just making sure that there were some questions in there that any company should be able to respond to. And that is what led us to kind of include that internal component. But it's been interesting to see over the 3 years that it's sort of proved out that a company is more likely to do well internally before also doing well externally.
And what are the drivers for that?
So I think that on the internal side, this is where a real estate company at the end of the day is a company, right? And I think we've seen across all different sectors, companies think more intentionally about how to not only design their offices, but implement programming and policies that support their employees as the workforce gets a bit more competitive. On the external side, it is this kind of peer competition. And then that's one of GRES is sort of performance is driven by 2 different things. One is the peer-to-peer competition, and the other is the investor engagement. And for the health piece, we've really seen the peer competition be one of the main drivers as health has emerged as a new explicit consideration within the real estate sector, and sort of is seen as the next way of differentiating yourself compared to your peers. Companies have been really eager to kind of be out in front of that trend.
Got it. Thank you. And on this topic, we have a question from an audience member. What kind of evidence of compliance can be submitted? More specifically, this member of the audience is saying that they have a health program for employees, but they're curious about the evidence requested and, you know, how it can be better supported.
Yeah, that's a great question. So for the policy piece, the evidence is simply the policy. For the needs assessment and the action and the monitoring, we're asking for evidence that actually substantiates that a needs assessment was taken, that actions are taken, and that monitoring is taken. And so that can look like either documentation from a service provider that you're using if you're bringing in external help, or a document showing the schedule of whatever type of mechanism you're using to understand needs and monitor outcomes. Many companies use things like surveys, so it could be uploading the findings of those surveys. We were very explicit from the beginning of the module that we're never asking for individual health data to be shared as evidence. So it would be more aggregate level. What have you found about your larger employee population or your larger tenant population in terms of their needs and wants from their space?
Great, thank you.
And then I guess one other piece on the action piece, I think the evidence could be pretty varying, but one form of evidence that might be pretty easy and at hand is that if you do have a building level certification, just sending in that documentation as evidence of the fact that you've taken action through the design or operation of your space in ways dictated by that certification.
So with that, I believe we wrap up the general slide portion. So again, audience members, feel free to submit your questions through the Q&A panel so that we can answer any remaining questions that you have, etc. One question that I do have for you, Kelly, is around the start of this movement. You know, how did health and well-being get started? Why is it such a big topic now, whereas, 5-10 years ago, it wasn't necessarily at the top of mind for commercial real estate professionals?
Yeah, I think it's a few things. From the health side of the conversation, the public health side of the conversation, the public health sector has been increasingly interested in the built environment due to the evidence demonstrating that the built environment really matters for health. But that interest kind of was very heavily focused on the planning sector, and historically hasn't gone much further than planning, which planning does have an influence, but it's not the only type of decision made within the real estate or within the built environment. And so I think that recognition of planning as one opportunity to influence, but not the only opportunity, has driven more public health focus from people like me and our colleague Matt Trowbridge and others to look at more of the private real estate sector as a potential driver and a major influencer on how built environments are made. From the real estate side, I think it really is a few things, sort of what I was mentioning earlier in terms of just the new opportunity for differentiation. When our team looks at the things that led to the green building movement success, one of the things was just the fact that green building certifications were able to position themselves as a differentiator within the real estate sector. It was a really easy way for builders of real estate to put something on their building and say, my building is better than your building, and therefore it has a higher value. And since green has become more pervasive, it seems like health has sort of organically emerged within real estate as the next opportunity for differentiation. That plus, there is this new consumer awareness about spaces and how they influence you. And so there is, I think, more of that consumer demand for buildings that positively impact your experience within them, and driven and I think influenced by some of these big employers such as Google and others that are thinking really intentionally about how their spaces are designed, and that's influencing others to expect that same level of quality from their spaces.
Got it. And is this that quote unquote wellness real estate industry that's kind of slowly blossoming in the past few years?
Yeah, I think so. I mean, one of the things that our team is really focused on, and I think most public health people that are involved in this conversation are focused on, is that we want to benefit from and leverage that interest in more of the wellness aspects of real estate, but we don't want the definition of health to end there, because it's easy to kind of think that, oh, you've put a gym in your building and therefore you've done everything you could do for a health perspective, and it's better than not having a gym, which is true. It is better than not having a gym, but it's not the only way that you're able to impact health through a building. The other thing that our team is really focused on is thinking about true population health. So thinking about the health of different scales of population. So not just the immediate user of the building, but also the community around that building, and then also considering more of the global impact of building scale decisions, which sort of brings us back to the origins of green building to begin with.
Great, and thank you. Heather, did you have a question?
Yes, sorry. So talking about, I mean, I'm so very interested in this topic. And I think that when you were mentioning, the Googles and such, there really is this, I think, proliferation of interest around making sure that buildings are designed a certain way and really attracting talent through this idea of a really nice space to work in, and a company really that invests in and values that as an employee. So I'm curious if your research includes any sort of or has made any sort of correlation there between the type of building, the improvements that they've made, and then that ability to attract and retain the talent.
Yeah, that's a great question. We haven't focused as much on the retracting and retaining talent, but in terms of the types of buildings that are interested in this, what was really fascinating to us within the most recent phase of work that we did when we were actually creating these prototypical health promotion tools and deploying them, on the lead side, we were able to actually work with project teams in a really hands-on way to apply these new tools. And we found that interest in this sort of intentional approach to health was really varied. I mean, it wasn't just the office sector, although if you look at the GRES participation, office is the most common asset or portfolio type that's participated in the module. But what we've seen on more of the project side is that it's interesting to offices, it's interesting to healthcare facilities, it's interesting to affordable housing, and just residential in general. We haven't had as much experience on the retail side, which is fascinating to me. But otherwise, we've seen some interest. And actually, one of the surprising sectors, more on back to the GRES side, is the industrial space, which has really, Prologis has really led the way on thinking about their buildings in a more holistic manner. So not just, thinking about the efficiency side, but also thinking about the impact of the buildings on the workers, and then also the community surrounding those facilities. We were really happy and excited to see Prologis release this economic workforce development initiative last year, which actually was driven by, they found that their tenants had this problem where they were having a hard time finding skilled workforce to work in these warehouses. And so Prologis took it upon themselves to sort of be the middleman and create workforce development programs in the communities around their assets in a way that helps their tenants meet this need of being able to engage a skilled workforce, which is just a really awesome example of how sort of bottom line traditional business concerns can be met in a way that also promotes social and economic health of the community around a building.
And shifting the focus towards that GRES module that we were talking about earlier, I'm going to go ahead and put the slide back here. We have a question from an audience member around organizations that are submitting certifications as evidence. This audience member is curious if GRES is distinguishing different certifications in terms of the weight or value that they're given. Are they all based on, say, the same value, or are there certain certifications that are gaining, more, let's say, gravitas in the industry or through the GRES module compared to others?
Yeah, so that's a good question. So the actual certification itself is part of the main GRES real estate assessment that asks. There's a section on building certifications, and so GRES has a very well-defined set of criteria that they use to decide what types of certification receive what types of credit. And I don't actually know those off the top of my head, but it's things like, requiring third-party verification, and I'm sure they're going to get into the performance piece as well now that more certifications are moving towards that. But that set of criteria is described within the main real estate assessment. So things like not just LEED, but also WELL and FitWell are recognized within that building certification piece of the main real estate assessment. So it's not something that we included, since it was already recognized by the real estate assessment. We didn't ask for that within the module. But I was just mentioning that if you do have a building certification, you can upload that documentation of the specific strategies that you implemented to meet that documentation as evidence for the fact that you took specific actions to promote health. Since the way that the building certification question works doesn't necessarily, I don't believe, require you to upload the credit by credit achievement. It's just uploading the actual certification. But we would need that credit by credit achievement to determine and verify that you actually did take those specific actions.
Great, thank you. On the subject of implementing strategies, I'm curious to know if there are leaders that are implementing specific themes of strategies into their buildings. I'm wondering if there's a certain best practice around implementing health and wellness strategies into, say, an asset or a portfolio of buildings, or if there's even an established quote-unquote best practice yet.
Yeah, that's a good question. I think that when it comes to kind of my favorite example of taking action at the building scale to promote health is really the Colorado Health Foundation office building in Denver. It's not surprising, since the Health Foundation, that they thought pretty intentionally, and not only is it a health foundation, it's also a health foundation that's really been leading on driving awareness of the connection between the built environment and health. And so when they went to create their office building, every decision that they made was driven by this desire to be able to create a space that promoted health at various scales. So again, that public health approach of thinking not only about your immediate occupants, but also the community and the global impact as well. And so that led them to pursue both LEED and WELL Gold certification. And they had a really beautiful goal in mind, that they wanted to create a health positive building. So one that wasn't just health neutral, because oftentimes, it's the history of the building movement. There was always a focus on making sure that you didn't do any harm with your buildings, right? Like you didn't have Legionnaire's disease, or you don't have toxic materials in your building, and things that are, you have safe spaces, places that people can escape during a fire and things like that, like really focusing on harm mitigation, which is a great first step. But moving past that, what can we do to really actively promote health of the building users? And so within that space, with this health positive frame, were able to combine the LEED and WELL certifications in a way that allowed them to think very critically about how to, again, not only promote the health of their employees, but also how to create spaces that were easy for their community members to enjoy. It even led them to make a decision about where to place the bicycle rack. They wanted the bike rack to be inside, but they intentionally put it on the exterior, like the edge of the building right next to a window, so that community members passing by would see that this is a place that people, you know, bike around and sort of encourage others to bike. And within that whole process, because they were so intentional and explicit about the health goals of their building, it actually had an impact on the construction company that was working on that building, where the construction company sort of added to their existing health program and thought more intentionally about the health of their own workers. And so it's just a really beautiful example of how placing health as an intentional and explicit goal of your building can have sort of ripple effects that don't only benefit the immediate users of those buildings, but have an impact on others that interact with that space as well.
That's awesome, and an excellent example of the, you know, wave impact that can happen with just one small factor change, like the placement of a bicycle rack. So thank you for that. With these sorts of changes, it sounds like a lot of the projects, programming, et cetera, are organizational changes and decisions. They seem to be driven across a certain organization. So how do you suggest that our audience members can gain support internally? How are you getting buy-in from upper management to support these health and wellness factors? And say you can't get that buy-in, how do you make those subtle changes to move your organization forward?
Yeah, that's a really good point and observation, because it really is an organizational commitment. I think it's going to be different for every organization, but at the end of the day, I do think it's difficult. Health is a bit different than green considerations in the sense that it's difficult for someone to come right out and say they don't care about health, you know, that it's like not an issue that matters to them. They don't, I think most business leaders understand that there is an inherent connection between the health of their employees, for instance, and how good they are at their job. And there's growing evidence around the productivity argument when it comes to actual building design and operation as well. So I think it's all about using those talking points to get a conversation started. The real challenge is holding people accountable to those goals. And that's where you need to come in with actually implementing policies that allow and support whether it be connection with different departments within an organization to make sure that these holistic decisions can be made, or the funding required to take specific actions, or the mandate to do specific types of monitoring activities. So I think I would imagine the real challenge is around the accountability piece. Once people say that, okay, yeah, this is something we care about, how do you actually act on that?
Got it. And on a related note, what is the risk of inaction on these factors, and how can real estate professionals utilize these quote unquote risks to catalyze change?
Yeah, that's a really great question. I mean, I think the most immediate risk is that you miss a trend and that your building isn't as relevant or as valuable as the next one because you didn't take an intentional approach to considering the health aspects of your building. I also think that it's not inconceivable that there could be new funding sources or financing sources that open up as a result of taking an intentional approach to health. There's going to be a breaking point within the US for sure when it comes to the healthcare spending piece, and hospital systems are already thinking more creatively about how to get to better health outcomes that don't require additional healthcare spending, because we've seen that additional healthcare spending doesn't have an impact. And so there's instances of healthcare sectors kind of moving into the affordable housing development sector and sort of providing new sources of financing to support real estate development that intentionally promotes and considers health. And so while that's starting off in community development and affordable housing, I think it will grow to engage and influence the private sector as well. So just being ready to engage with those new types of partners that would be associated with new types of financing is a really potential source of value. And the risk is if you don't do that, then you're sort of missing out on those new business opportunities.
Great. Thank you for answering that. So I have one last question. I recognize we're coming up at the end of our time slot. So with the shift from quote unquote green buildings to ESG, environmental social governance, and those factors, how are health and well-being playing into this framework? And where is health fitting into presumably all three E, S, and G within this mindset?
Yeah, that's a great question. And yes, we also feel like health is within all three E, S, and G. It's just a different type of health that we're thinking about within those three. When it comes to the green building to sort of health transition, it's really about being intentional about health because human health has been a consideration of the green building movement from the start. We care about green buildings because we want there to be nice environments for humans to experience in the future. So there's always been that human aspect, and there's been aspects of health when it comes to indoor air quality and daylight and views and things like that. But just being more intentional about how one individual project or one portfolio aims to promote health is really the next wave. And so that allows for a connection to be made between more of the traditional green strategies and these emerging health strategies, and combining the two in a way that, again, benefits the immediate users of the space, the community around it, but then also retains that global health benefit of the climate change mitigating strategies found within traditional green buildings.
So with that, we're at our allotted time slot. I want to thank Kelly again so much for joining us today. If you have any remaining questions, feel free to follow up with Kelly directly or with myself directly. If you have more questions or you want to learn more about the Green Health Partnership, you can check out their website. You can check out more of the research and some of the papers that they've published there. So again, thank you so much everyone for joining us today. As I mentioned at the beginning, this webinar has been recorded and we'll be distributing it in the near future. So hope you all have a great day and look forward to implementing some of these health and wellness factors into your own buildings. Take care, everyone.